Hey, this is Terrance from my lab. Today we're going to talk about frozen shoulder. Frozen shoulder is a condition when the capsule on the ball and socket joint thickens. So when we go to elevate, we get this kind of hiking movement. So the goal of these exercises is just to increase range of motion. So what we're going to do to start off is a posterior capsule or a capsule distraction move. So what we're going to do with this is get a thick TheraBand a little bit elevated. We're going to grab, sit back, and just let this distract. So the idea of this is we want to get a little bit of distraction in that ball and socket joint. You're also going to get a little stretch for your lat, but ideally you want to get this little separation between the capsule and the ball and socket joint. So just let that relax. Typically hold that for about 45 seconds to a minute. Our second exercise we can do is our passive dowel raises. So what we're going to do for that, if I had frozen shoulder on my right side, I'm going to put the butt end of my hand into the stick. And then we're just going to work on passive range of motion. So with this, I'm just going to go to a point where I'm getting discomfort, but not pushing past that. So come up, I might get a little pain, and I come down. Up, a little bit of pain, and then come back down. So we'd go into horizontal abduction. Okay. Second movement we do would be extension. So I'm going to come straight back. Again, go to what I can tolerate. Just back and forth, trying to keep my right arm as passive as possible. Okay. And then the last movement we're going to do is forward flexion. So for this one, take the stick behind the back, and then we're going to push with the left hand forward so my right arm comes up. Elevate, try to get it as high as possible, hold for a second, and then come back down. Again, the idea of these is just to try to improve your motion. Our next exercise is a passive countertop flexion move. So what we're going to do for this is just get to the edge of your kitchen table or desk, and we're going to passively hold, sit down to a squat, which is then going to elevate the shoulder. So this arm's just nice and relaxed. I'm going to sit back, try to get as low as possible so I get elevation of the shoulder. Come back up. With the idea being I want to get all the way down or as close to as I can. Again, it can be a little bit uncomfortable, but we're just trying to improve that movement. The final exercise we're going to do is a dowel subscapularis release. So your subscap is a muscle that sits on the front of the shoulder blade, comes out and inserts under the arm. It's your only rotator cuff that's an internal rotator. So what we're going to do for this is get the dowel, get it up in the armpit, directing it towards your shoulder blade. So I don't want it coming straight back, which is going to get more towards my lat. I want it almost coming up and in. So I'm just going to get a good pressure. It's going to be a little bit uncomfortable. I lean in, and then from here I can use my offhand to give a little assistance in range of motion. Just trying to get that muscle to release. Just back and forth. Once that gets a little bit easier, I can go into active movement where I'm just rotating the arm actively. Just back and forth. So that's one you want to do until you feel the muscle release about halfway of the tension. So give those all a try, and thanks for watching.